T4.3. A study of treatments for angina, which is pain due to low blood supply of the heart, compared bypass surgery, angioplasty, and the use of drugs. All right, so that sounds like three different things: surgery, angioplasty, and drugs. The study looked at the medical records of thousands of patients whose doctors had chosen one of these treatments. Okay, so thousands of patients, the doctors chose the treatment. It found that the average survival time of patients given drugs was the highest. Okay, so the survival time of those on drugs was the highest. What do you conclude? All right, so first of all, I want to focus on this part of the question here. The doctors chose the treatments. Okay, the treatments were not randomly assigned, but the doctors made some sort of personal choice as to which treatment they would give to their patients. Okay, so this is not an experiment. In other words, it's an observational study. All right. So, because it's not an experiment, we cannot make any cause and effect conclusions. We can only make conclusions about correlation or association. All right. But there's no way that we could say that the drugs caused those patients to have a higher survival time, because there might have been something else different about those patients besides the fact that they were given a drug. All right, so let's look at the 5 answer choices with this in mind, that we should only be making conclusions about correlation, not causation. Okay, so statement A, this study proves that drugs prolong life. So yeah, I already don't like the word choice there, proves. Okay, that sounds too much like cause and effect. Choice B, we can conclude that drugs prolong life because the study was a comparative experiment. It was not. Choice C, we can't conclude that drugs prolong life because the patients were volunteers. Okay, were they volunteers? It doesn't really specify whether they were volunteers. It just said that they looked at the medical records of patients. So I don't even think they're volunteers. It's not like they volunteered their medical information to the study. So I'm going to eliminate C. All right, D. We can't conclude that drugs prolong life because the groups might differ in ways besides the treatment. Okay, I like that one a lot. E. We can't conclude that drugs prolong life because no placebo was used. Okay, so going back to D, right? As I mentioned, that there might be something else different about the groups besides the fact that one got drugs and the other got, something else, right? If you think about a doctor's choice, right, they might prescribe one treatment to patients whose initial health is really bad, and they might prescribe a different treatment if their initial health is really good. Right? Like surgery, for instance, right? They're only going to prescribe surgery if the patient is healthy enough to undergo surgery, right? Because they have to, there probably needs to be anesthesia and things of that nature. So they're not going to prescribe surgery to the really, really, really sick patients. Okay. So a patient's prior health status might be a confounding variable with the effect of the treatment. Okay, so we're going to solidify our answer with D.